Hello, my name is Ilka Fedor and I'm a member of the Community Health Council.
Kia ora, my name is Kelly.
Hello, my name is Martin Burke and I'm a member of the Community Health Council.
Hi, I'm Bronnie Grant and I'm from Gore.
Ko Sarah Derataho.
Yeah, I'm Leslie Gray from Invercargill.
Hello, my name is Paula.
I've seen both quite positive aspects of the system, but conversely quite negative aspects. So I guess my motivation was to ensure that those positive aspects get spread across the wider community.
I have a deep interest for many of the topics and areas that we're covering in the council now.
I think more and more the decisions that our healthcare system is faced with really needs multiple sources of input in order to make those decisions.
I've always been interested in the area of health in general, and I just wanted to get involved in more things within my local community.
I have that sort of patient interest and also care very much about our healthcare system and people's pathways through it.
Learn more about health provision, especially being from a rural area.
Well, I guess it was my nursing involvement in both in hospital and in community work over many years I've kept my interest in health.
Women and children's health. I as a mother of 3, I've had a lot of experience within the maternity care, of course.
Of particular interest is Māori, long-term health conditions, rural communities, all because that's my background experience and in the community that I live in.
Addictions, mental health and intellectual disability, because I see them as being incredibly challenging areas for our future. I'm really interested in men's health care in general, because I think as a population we men often neglect our health quite badly.
Women's health and people with disabilities. I've got lived experience of disability myself and involved in a lot of local community groups plus some national groups to do with disability and blindness in particular. And I'm also now getting quite interested in the health system for older people with having older parents.
So I'm particularly interested in how people move through our healthcare system, and that people have really good information about the healthcare system and where they can go and turn for help. And I also come from this area of interest in terms of a specific cancer, but I'm particularly interested in cancer pathways and outcomes for people.
I have a young family, so naturally I'm interested in preschool children and families in general, rural health and also women's health.
Mainly at this stage of my life, the older patients, but I've got a family too, so women's health and men's health, children, they're all of concern, and I think encouraging people to have health checks regularly, immunisation and things like that, but probably the older person at this stage.
Well, I really hope that the CHC will be able to reach out to the community and get a true voice of the community, because I feel that patients have such a wealth of knowledge when it comes to how healthcare can be planned, because we are the ultimate user of the system, and we are the ones that are affected by all the policies that are created.
I think it's a great opportunity for us as community to have input into a system that we partake of. So it's, I think there's going to be a great future ahead where community voices like ours will become part of the systems that will be created. So
I think it's really good that we listen to what consumers want and need and try and put some of that into place so that being treated with a health condition can be a positive experience.
I think the Community Health Council is really exciting for a number of reasons, because we as a group are interested in the southern healthcare system in total. So we're not just focused on the hospital, we're very much interested in our communities and primary care services and that whole network in the Southern health system. So I think the really exciting thing for us is having everyone throughout the region feel that they can have a say, their feedback matters and counts, that it's okay to raise issues when things are not going so well. It's great to also compliment. We have some amazing staff, 4,500 staff working within the Southern health system region. So it's really important that people feel, it is our healthcare system. And so for everyone to really understand that and feel that actually their voice counts and they can raise issues that matter to them and their whānau.
The Community Health Council could be quite instrumental in informing consumers about the healthcare system as a whole rather than all these different providers, and that people will hopefully have the opportunity to learn more about their healthcare system.
And amongst all the plans, strategic plans, funding, financial things, treatments, rebuilds of hospital, commissioners' reports, workshops and all these things, right in the middle of that there is a person. And it is that person that I'm feeling interest and concern for. And I'd like to think that they are placed high on the list for everybody when they're thinking of their health systems.